How EMT Fred saved Matilda's life with a great patient care report. Fred, an EMT with the Bedrock Fire Department, responded to an early evening call for a woman who experienced a syncopal episode. As he arrived, the first snowflakes of winter began to fall, blanketing the quiet suburban street in a thin, sparkling layer. He quickly assessed the scene, ensuring it was safe and confirming that there was only one patient. With an ambulance on the way, Fred knew he had everything he needed to begin his evaluation. Initial assessment. Fred introduced himself to Matilda, a frail but alert woman in her 70s, sitting in a chair in her living room. She was in obvious respiratory distress, her breaths shallow and labored. Her skin was pale, cool, and dry, and a home pulse oximeter on her finger displayed an alarming SpO2 reading of 58%. Acting swiftly, Fred placed her on high-flow oxygen via a non-rebreather mask at 15 liters per minute. Almost immediately, Matilda's breathing became slightly less labored, though she remained visibly unwell. Detailed examination and history. Fred proceeded with a thorough assessment, while asking Matilda about her medical history and the events leading up to the episode. Her story revealed crucial details: signs and symptoms, shortness of breath and leg pain, specifically a burning sensation in her right calf, allergies, none, medications, cardizem for an irregular heartbeat, past medical history, irregular heart rhythm, last meal, a sandwich 4 hours prior, events leading up. She had been bedridden for a week due to feeling unwell. That day, feeling slightly better, she went for a walk, experienced leg pain, and quickly became short of breath. Fred's physical exam findings were consistent with a patient in respiratory distress, but without immediate signs of respiratory failure. Head, neck, and chest, jugular vein distension, clear lung sounds, accessory muscle use noted. Lung sounds, clear and then equal with good tidal volume, abdomen and pelvis. Normal. Extremities, unremarkable, except for tenderness in her right calf. Good distal circulation, sensation, and movement in all extremities. Vital signs and documentation. Fred recorded her vitals. Blood pressure, 106 by 152. Pulse, 128, strong and regular. Respirations, 32, labored. SpO2, 58% on arrival, improving slightly with oxygen. Understanding the potential gravity of Matilda's condition, Fred wrote a clear, detailed patient care report while waiting for the ambulance. He documented her history, complaints, physical findings, and his interventions. He emphasized the sequence of events, particularly her week of bed rest, calf pain during the walk, and subsequent respiratory distress. Handoff to the ambulance crew. When the ambulance arrived, Fred provided a verbal report into the paramedics, reinforcing the highlights of his findings. They loaded Matilda into the ambulance and transported her to Mother of Eternal Sorrows Hospital, where an overwhelmed nursing staff received her. The power of documentation. In the chaotic emergency room, Fred's patient care report proved indispensable. The nurses, preoccupied with multiple patients, relayed minimal information to the attending physician. However, the doctor reviewed Fred's meticulously written report, which provided a clear picture of Matilda's presentation. Bed rest for 1 week, calf pain following a walk, shortness of breath onset after calf pain, elevated respirations and low oxygen saturation. Recognizing the signs of a potential pulmonary embolism, a life-threatening blood clot in the lungs, the doctor ordered a rapid workup, including imaging and anticoagulant therapy. Matilda's condition stabilized, and she later made a full recovery thanks to the swift and accurate diagnosis. Conclusion. Fred's attention to detail and comprehensive documentation not only ensured Matilda received the right care quickly, but also highlighted the critical role of EMS reports in the chain of survival. The moral of the story: clear, detailed documentation can save lives. Whether on the scene or years later in court, a well-written report is an EMT's most valuable tool.